Good morning and welcome to Resource Zoom with the Louisa County Chamber of Commerce. I'm Tracy Clark, the Executive Director. And this morning, I'm really excited to introduce you to Shannon Miller. Oh my gosh, whoops, it's early. To Shannon Miller with 360 Health and Wellness. She's a new business in Louisa County, but not new in terms of your experience. And in meeting with her and getting to know more about her business, I was very intrigued, both on a personal level and also a professional level, as a resource for a lot of our small businesses. And I'm really excited about the information she has to share with you. It's a concept called direct primary care. I'm not going to get into too much about it because I'll probably mess it up, but that's why we have you, Shannon, this morning. Thank you so much for joining us. I'm looking forward to sharing and learning more about how this concept can really help our small businesses provide benefits or resources or even cost savings to their employees and also their business as it relates to healthcare and benefits. So why don't we start with Shannon, maybe just a little bit about what is direct primary care and what's happening with that.
Sure. Well, thanks. First of all, thanks for having me this morning so that I can share all of this wonderful information with you. So direct primary care it's not a new concept, but probably new to a lot of people who haven't really heard of it. It's kind of a phenomenon that's going on across the country with family providers who kind of have just reached their limit with corporate medicine and insurance-based fee-for-service medicine, which is your typical primary care office. And so direct primary care is essentially the same as what you normally do. You go to your doctor, you're seen for all the things that you need on a normal basis. So chronic conditions, acute care, if you're sick, things like that. It's just a membership-based service. So you monthly will pay a membership fee. And in that membership comes all sorts of things. Traditionally, if you go to your primary care office, you're going to pay a copay. And then you'll go in and be seen for whatever it is that you're seen for. You'll have your labs done. If you have a procedure in the office, so if you have an abscess or you have a mole that needs to be removed, or you want an injection for your knee pain or something like along those lines, or if you get a rapid strep test done, all of those things are then billed to your insurance company. And then typically you're going to get a bill in the mail for whatever insurance does not cover, so your portion. And with people that have high deductible insurance plans, that can be a lot of money. You can get a $200 to $300 bill after you see your doctor. But with a membership-based service like mine, direct primary care, all of those things are included in your membership. So for instance, the membership is set up based on age. So there's a different price for each age, and it's ranging from $30 to $75 a month, depending on your age. And that basically all of those things will be included. So you can come to me 15 times in a month and have all sorts of things done, and you're never going to pay more than just that membership price. Now, of course, if you have labs and things like that, so that's the only thing that's outside of that. Your option would be, if you have insurance, you can bill to your insurance company, or I have wholesale lab prices. So for blood work that may cost you $100, in a normal insurance practice, may only cost you 15 or 20 bucks through my services. So that's the option there. But in general, I think what people want now is to have a relationship with their doctor or their provider, because they don't want to go into an office and see 5 different people every time they go in. I feel like most of my patients currently feel like when they come to the doctor, they're not seeing the same person every time. And so how can they have any continuity of care if they're not seeing the same person? And then also just not being able to be seen. They have something going on and they call and they can't get an appointment for 2 weeks or 3 weeks. And so then they're forced to make a decision. Do I go to the urgent care? Do I go to an ER? And then the cost of those services just continues to go up and up and up. And so with the direct primary care model, you won't have to wait to be seen. As a direct primary care provider, I will only take a certain number of patients. And so I will make sure that no matter, you will get seen most often same day. If it's not something that you have to come into the office for, I can address it through text message, through email, through phone call. There's no restraints in terms of how I can see you. Whereas in an insurance-based practice, most times you're going to call and they're going to say, no, you have to come in. And the reason is because your provider in that practice doesn't get paid unless they can bill insurance. And the only way you can bill insurance is to go into that office. So in this model, we just take that out. We take out the insurance piece and take away those barriers to care. And so that's what I'm most excited about, because I feel like I already do that in my practice, and I probably am not, making them as much money as they would like. But at the same time, we don't have enough spaces for patients to be seen. So I just feel like in order to provide good care, I can't just tell them you have to wait. And I'm not going to tell them to go to an ER. I'm a prior ER nurse for 9 years. And so when I see people that I have to send to an ER just for something simple, kind of like makes me boil a little bit, because that's not what the ER is for. And especially right now during this COVID pandemic, we want to avoid sending people to places where they potentially can be exposed to things that are going to be harmful to them. Not to mention ER and urgent care wait times right now are astronomical. So that's my hope, is that providing this kind of service will kind of take us back to how medicine used to be, and have a better relationship with your provider, more trusting. You have continuity of care. There's lots of avenues for care, like I mentioned, the text, the email, and video, and all of those things. So just better care, which is what we all need, because in general, if you're getting better care, preventative care, chronic care, what have you, the cost that you're going to be spending on your health is going to be lower, because you're going to be sick less. You're going to be managing those chronic illnesses better.
Yeah, and one of the things that, we're talking a little bit right now more about the specific individual, what is direct primary care? We're going to get to, how does it impact a business? Like, how does a business work with direct primary care to be able to potentially offer health benefits or coverage to their employees in scenarios that they never could before, right? Because it was too cost prohibitive or not enough employees. I mean, I know I just went through that. Like, if you didn't have a certain number of employees, you couldn't get proper health coverage for your employees, things like that. So I'm excited about getting to that piece. But just one more or a couple more questions as it relates to what is direct primary care? What would be the experience for the individual by being part of this program? A few questions that I have. You mentioned about, filing to your insurance, right? You still encourage us to have insurance, but perhaps it's a really high deductible insurance. In those scenarios where something would have to be submitted to the insurance company, what's the process on that? Is that something that you, as my membership, that you help me with, or do I now have to learn how to submit claims to an insurance company? Tell us a little bit about that.
Sure. So in general, you won't have to be submitting any claims to insurance, because when you're coming to see me, as a primary care provider, 85 to 90% of your care, I'm going to take care of. So nothing on my part really needs to be submitted to insurance, because there's not going to be reimbursement there. All of that's covered in your membership fee each month. Now, when it comes to labs or blood work, so I give the option, and patients can, if they want, they can inquire with their insurance what the labs are going to cost them, and then look at my pricing and make a decision. Do they just want to pay mine because it might be cheaper? Like, for those that have a high deductible plan, that might be the better option. In most cases, it will be. Or if they have a regular insurance or an insurance that's a good insurance, then I will put in their bill to insurance for their labs, so they don't have to worry about it. They may need to just provide me with their insurance information, so that when I submit it, it goes through and it's billed to them by insurance. But there's nothing extra that the patients are going to have to do in order to submit anything to their insurance. Now, outside of that, so just like anything else, so say you come to me and there are things that we can't manage, so like orthopedic injuries or things like that, if it's beyond a basic injury and you need imaging, I will help get that referral set up so that way you can get imaging done. I'm in the process of getting some better like wholesale prices for imaging and working with like a mobile clinic in Richmond. So I'm trying to get those prices done, that people that maybe don't have insurance, or if they have a high deductible, that might be a better option. So that's in the works, which I think will be helpful. And then, again, referrals. I will send referrals just like any other primary care office would need or would do. So that I take care of. And it shouldn't be much extra work for a patient on their part, because I'll be sending those for them. And the same is just being their kind of hub, their central care coordinator. So making sure I'm, staying in contact with whoever they're seeing as a specialist, so that we're kind of coming full circle on their care. Now in the insurance piece, so how does this kind of help a small business? I think what's great about this option, or what I'm excited about, is that I know there's a lot of small businesses that don't have a lot of employees. And so they're not able to really offer health insurance because it's expensive. And so this might be a good option to be able to offer your employees as an incentive, to stay on with the company, or an incentive when hiring. Because I know right now it's really tough to get people to come to work, and they want some reason to come to work. And so if you can't offer a health insurance plan, this is a really good backup, because again, like I said, 85 to 90% of a person's care is going to be a primary care provider. That person can take care of all of those things. And so you might spend, on average, say your patient's age, we'll just go with in their 40s, $45 a month for that person to get care. And so in the grand scheme of things, that's way cheaper than what you would be paying for an insurance plan for that patient. Now, again, I would still encourage that person to, if they could, to explore what we call a catastrophic plan. And that's for like emergencies. So if something, if they got injured, or they had to go to an ER, they had to have a surgery, that covers them. Or they can explore a marketplace high deductible plan that may only cost them a little bit a month, $100, $150 a month, or whatever it is, that the employer is maybe paying for their membership. And so that's where I think my practice will come in handy for some small businesses, is that they can know that their patients are going to have some care, and also knowing that their patients are going to get the care they need in a timely manner, so that they are healthy and back to work. Because I think that's what's most important for businesses, is that patients get sick or something happens and then they can't get to their doctor. So then they're out for a week or 2 weeks, and then that business is short. So I think that's the biggest thing, is keeping the employees healthy and at work.
Yeah, it's a really, really different approach to kind of the norm, right? When I think about people out looking for jobs, I know even when I was looking for jobs, having health insurance was really important, right? For all of these reasons, protection for care and things like that, and minimizing the cost. I mean, it's expensive, even just to go to a doctor's visit. If you don't have insurance, it's really expensive, no matter what the severity of what the issue is. And I'm not going to lie, people like me, my preference is to not to go to the doctor. I would rather just let me see if I can remedy this until it gets severe. And then, that's not a healthy way to take care of yourself either. You want to be proactive instead of reactive, right?
Right.
So for those people that health insurance is really important for, the head of the household that needs health insurance for their entire family, kids, and so forth. Is your program flexible to accommodate for that as well?
Yeah, absolutely. So this membership is not just for the employees, but could also be for their family. And so that's kind of going to be up to the employer on how they want to approach that with their employees. Do they want to offer, maybe they pay full price for the employee and then they offer paying 50% of the membership for the family, or they cover the membership for the entire family. It's up to the employer how they approach it. But I do also do family pricing. So I do see kids, I see everybody. So, babies on up to geriatric, that there's no age limit for what I see. But I do a family plan, which includes 5 people, and that's at $175 a month. Now, granted, if I'm going to have an employer come to me and they're going to enroll multiple families, we'll work on that pricing, because I want to make sure that business has what they need. And so that pricing can be adjusted based on the amount of members that they're going to enroll in the program.
Right.
But that pricing in general is a good price just in itself, without a discount, because you're going to get 5 members, you're going to get 2 parents and 3 kids. And so that's a good benefit to have as well.
And when you set up your pricing, it's much like when you're looking at insurance plans, right? You can set it up where the employer covers 100% for the employee, or they split it or something like that, right? So this membership fee that you're talking about, it could be employer pays it all, or they split it with the employee, minimizing their expenses, things like that, right?
Correct. Yeah. So however the employer wants to approach the membership is certainly, it's in their hands. That's their decision on how they want to do that. Some employers will pay full price, like they'll pay everything. And then I've had other employers decide, okay, well, like I mentioned, I'm going to cover the employee, and then I will only cover maybe a portion of the family, or depending again on the employer's ability, they may only cover 50% of that person's membership, and then the person is required to cover the remaining. So whatever the decision is, we create that contract, and that way we know, how we're getting paid. And it's a monthly billing cycle. I think at this point, because it's new, I think it's a good idea to just keep it on a monthly billing cycle to let people understand and see how things go. I think in the future that may change, but since I'm a new business and I really want to gain my community's trust, I think a monthly membership allows that, so that if it's not working, you're not locked in for a year.
Yeah. And so, gosh, just all these questions keep popping up. So this is great. So is there any particular size of business that you would not be able to accommodate? Like if I have 250 employees, would you still be able to accommodate this membership plan for that size, or is there some maximum?
Yeah. So in general, my goal as a sole provider right now is to be less than 600 members. And so when I'm getting, that's my goal, is to stay that way. Now, I have had interest in terms of other people joining me in this direct primary care venture. And so, if the time comes that I'm getting more interest and I have more employers that would like to have this type of service, then I'm going to just hire on so that I can make sure we take care of the community, because the interest is there. It's just a matter of getting things established. So for me specifically, just right now, 600 members is going to be my limit. As I know I'm approaching more, I will certainly be looking at hiring other providers to take over the remainder.
So if I have a business of 250 people, you can take on my business.
I can, absolutely.
I gotcha. And just for clarification for folks, I want to remind them, you have that limit of number of patients because you want to ensure and guarantee being able to see them and, that sort
Absolutely. Yeah. And that's the whole thing, is that you're a normal primary care provider in a private practice or corporate medicine practice. I mean, our patient panels are huge. Just for instance, my patient panel before was 4,000 patients. That's a lot of patients. And it becomes tough. And so obviously not all of those patients are getting to see me as regularly as they would like, because it's nearly impossible for that to occur.
Yeah.
And it's not ideal for me. I really, really enjoy the relationships I have with my patients. And I have a lot of patients that have followed me and continue to follow me because I get to know them and I spend time with them. And it's my relationship with them is beyond what's in our office. I feel like it's, they become somebody that's important to you. And that's why I love what I do, is I really, really do care about my patients. And so I don't want to take more than 600 because I want to make sure that remains.
Yeah, absolutely. So even if I am a sole proprietor or a real estate agent, or, some of these other professions that don't normally have health insurance that have to go out, I can participate in your membership program, right?
Absolutely.
Okay. And that's just contacting you directly, or so. The topic of direct primary care, I want to touch on that real quick, and because it is kind of a new term for general population. And when I've mentioned it to a couple of people, like, hey, have you heard of direct primary care? I've gotten a response of, oh, is that concierge medicine? And can you explain a little bit the difference between the two, but also, you might be starting this business new, but the concept of direct primary care is not really new. So give us a little bit of history about that.
Sure. So concierge medicine is kind of this terminology that came about that people assume that it is for wealthy people or people that have a lot of money. Because in general, when concierge medicine started, that's kind of where it was aimed for. It was aimed for people that had money, and they were kind of like the doctor that's at your beck and call. Like, we'll be there at any point in time, any time of the day, they'll come to your house. But they also are kind of like a split office. So they still will bill insurance at the same time collecting this membership fee. So it is kind of like a double whammy. So you're still having to pay insurance prices as well as a membership fee. Whereas direct primary care, that's not the case. We're not submitting to insurance, so you're not going to have any other bills from insurance. You're just going to have the membership fee. And the direct primary care membership fee is a much more affordable fee than concierge medicine. Concierge services a lot of times are $100, $150, $200, something that's really expensive. And that's not the case with direct primary care, at least not with my pricing. Pricing for direct primary care kind of varies across the country, and it varies in the areas and states that you're in. And my goal was to keep prices affordable, especially in a rural setting, because I am trying to reach a lot of people. I don't want this to just be a service that, people that have more money can afford. I think that this is an affordable service for people that truly, want to have good health care. And I do think that, it's not more money than a cell phone bill. And for most people, it's less than a cell phone bill. At least my cell phone bill. So, I struggled to leave my practice because I was worried about how I was going to miss the people that I really want to serve, which are some of the more underserved or the rural community, because that's the community I grew up in and love. So that's why my prices are what they are, because I feel like everyone deserves to have access to good health care. And I think they'll pay for it if they know that they're going to get all the things that they need.
Yeah, well, I think it's a great concept. I'm very intrigued and excited to be sharing this with people so that they know, because that's, it is taking hold, right? It's a growing concept, which is pretty exciting. So your particular practice, or, well, I know for you with direct primary care, is it people have to come to, I know you talked about they don't always have to come visit, some of the stuff you can take care of over the phone. But if we do have to have a face-to-face, is there a location? Do you come to my home? What's that process like?
Yeah, so I do have an office, which will be opening October 1st. So it is, I call it Zion Crossroads, but the address is Troy. It's in the Zion Crossroads Business Park, which is right off of 250, right off the road, and 250 right in Zion's. And so I will have, I'm sharing a basement suite with a massage therapist. So I have my own office space. We have our own waiting room. And so that that will be there for people that need to come into the office. And for sure, we're going to need people to come in. I mean, employees need their yearly physicals, employees that have chronic conditions. There's definitely things that we need to have them come in for. But the other thing is that, for a lot of stuff, I don't necessarily need patients to come into the office all the time. And I think that's the other benefit of this to employers is that employees miss days at work for having to go to doctor's appointments because sometimes it's a half a day affair because most doctor's offices are running 45 minutes to an hour behind. So that may not be the case for this kind of situation. So if a patient just needs like a quick follow-up, if they're following up on blood pressure, or if I just need to talk about their blood sugar, if it's, something simple, and I know that the patient is monitoring it at home, we could do a video visit. We could do a phone call, just checking in with one another to ensure that things are monitored so that they're not missing a half a day at work or they're not missing a full day at work. But again, there definitely are times. I mean, I do want to see my patients. So at some point in time, yeah, they're going to come in but they're not going to have to be there for a long period of time, or they're not going to have to wait rather. That's my big thing is I hate being behind. So I'm typically never behind. But I also want to spend time with them. That's the other good thing about this is that they're not going to be rushed. It's not wait 45 minutes, see you for 10. I will spend as much time as we need to spend without having rushing through.
Do you, if I'm an employer and I take on direct primary care, let's just say my business is in Mineral, which is a good, 30 minutes or so from your office, but I have, 10 employees. Could we set up something where, once a month you come and you do standard checkup things, whether it's blood pressure or, or even if you come and maybe I wanted to do a monthly clinic with my employees about managing their stress or what sugar does to the body, anything like that. Are you able to do those kinds of things as well, or?
Yeah, so that's definitely something that direct primary care is able to do. And there are just from research that I've done and lots of mentoring, that is something that's offered to employers, especially employers that have more employees and they're interested in doing those types of things. So for instance, some companies that maybe have more employees, we could have a scheduled time monthly that I come out and do physicals on patients. So whether they set it up like it's their birthday month, or they have this select amount of people this month or this amount of people this month, as long as they have a little bit of a space in their office for this, then absolutely, I could certainly, set out a day or a time where I come to their place of business and do their physicals or whatever it is, or if they have other things like you mentioned, they would really like their employees educated on certain things. I can certainly prepare some things like that for them if that is something that they want to pursue.
Gotcha. Okay. Well, let's change, well, not dramatically, but just I'm just trying to think of some things medically, right, that you typically get from your doctor or that your doctor handles for you. So prescriptions or medications. Mm-hmm. The process like working with direct primary care as it relates to, prescription medicines or having to get that stuff filled. Are you working a lot with pharmaceuticals? Do you tend to lean more towards natural? What's kind
of so in terms of medication management, so I guess first thing I would talk about is cost. And I think we all know that the cost of medications can be really expensive. So I do use, like for folks, even actually for folks that don't have insurance, but even sometimes that do have insurance, Goodrx is a service that I use because their pricing is so much lower. So generally for people that don't have insurance, it is the way to go because they'll get those medications cheaper. But even sometimes when I know that someone has insurance, but they still have trouble affording their meds, I still will look it up on Goodrx and I'll say, hey, just go tell them you're using this, you're cash pay, you're not going to run it through your insurance. Because I would say probably 45% of the time, people can use Goodrx and they're going to pay half as what they would pay with their insurance, which seems
Wow.
silly, but it's true. And a lot of providers don't take the time to look that up and just send meds because they don't really know the cost. It's not something that's ingrained in their brains to think about. I feel like my background kind of prepared me for that because I worked at a federally qualified health center where most people did not have insurance. And so they paid on a slide scale. So I got to know workarounds for meds. So I do try to utilize that. I'm also in the process of trying to get some wholesale medication prices for commonly prescribed medications. It's really tough for, of course, the brand name medications. That's always going to be a tough thing for us to conquer. But, there are ways to submit, things to to pharmaceutical companies. So if you're making a certain amount of money, you can always fill out paperwork and try and get a discount. And it's sometimes, a lot of people do get approved for it. I think a lot of times we just don't take the time to do it for patients, but a lot of pharmaceutical companies will give discounts or free medication based on your income. So another thing to think about, we could do that. Now, how do I approach medicine and how do I treat? So I am traditional Western medicine, but I also feel like preventative medicine is my approach. So I want to prevent chronic illness, chronic disease. So that's one reason I want to see you at least once a year, get your physical done, and maybe twice a year if you've got something that's kind of borderline, like if your blood pressure's been running high or your sugar's been kind of high, or say you're working on your weight, things like that. I want to make sure that we're keeping those things in check so that we avoid having to give you medication. Because yes, medication is great and we need it sometimes, but we all know that medication can cause side effects. And so I think if we can manage things without it, we will and we should. But when it boils down to it, if I recommend a medication for a patient, it's because I feel like you truly need it. And so I'm never going to push it on you unless I think that is 100% what we need to do.
Yeah, that's great. Because I'm not, anyway, that's just me. I would rather try to fix things. So I've been asking a whole lot of questions, taking up a bunch of time. I want to give you an opportunity because I know you prepared to share particular information. I don't know if we've covered that or not. So is there some information you want to share? Do you want to take over the reins? Do you have anything? I know you mentioned a video that you wanted to show. So where do we go next?
Yeah. So I think the other piece of this morning was to kind of also help small business who maybe already do offer insurance. How can they utilize direct primary care, and why would investing in a direct primary care practice benefit them? So the traditional small businesses usually do like a fully insured insurance program. And so they're contacting their insurance agents, and those insurance agents are going to, of course, tell them what insurance plans they need. And, they're going to try and get the best prices, et cetera. But what is sometimes, I think, what is a better way to approach getting insurance for your employees with the direct primary care membership is a self-funded insurance program. And I think a lot of small businesses shy away from that because they assume that's only for large companies that have a lot of money that can afford that, but that's not true. Small businesses can do the same thing. They just have to work with somebody that knows how to do this. And so if I have a resource and he is wonderful. He is the husband of someone else who does a direct primary care. And he just got very passionate about trying to get employers to get into this direct primary care, to utilize direct primary care, because our goal as direct primary care providers is to drive down the cost of healthcare. Instead of up. Right now, we're just continually, it's inflation. It's just insane. But if more businesses move to this model of care over time, granted, it's going to take time, but the cost of healthcare should come down. So the self-funded insurance programs are possible. You just have to work with someone who knows how to do this for you. And so if you move to that model, if you move to a self-funded insurance program, they're showing, sorry, dog. there has been statistics that show 15 to 20% savings over the first year, and then maybe an additional 10 to 15 over the second year. So you're getting savings because your patients are healthier, they're getting seen, there's less ER utilization, there's less urgent care utilization, there's less claims being made because your employees are being cared for and they're not as sick. And they're getting all of the care that they need in that membership. So you're not having so many things submitted to insurances. So you're able to afford a self-funded health insurance plan because there's not a lot of claims. So I do admit some of that is a little bit above me and how we manage that, but that's why I have Nir. He is he's a wealth of knowledge and has kind of created this system to where he can hook in to finding insurance plans that work for your business and couple with a direct primary care practice. So
Okay.
the video I have is from him. So I'm gonna share my screen.
Yeah.
So let me open it. So this was my website, but let's see. Here we go. Okay, so the direct med, it happens to be his wife's practice. So just keep that in mind, but this is just something where he goes in depth about direct primary care and then goes in to talk about how he has made this different company to help small businesses couple with direct primary care practices. Okay, can you see it?
You can see it.
After we started Direct Med and we started taking care of many individuals, couples, and families, and getting ourselves out into the community and meeting a lot of employers and becoming friends with them and hearing their frustrations, that's when we really realized that direct primary care is the perfect solution for businesses to solve the problem of affordable healthcare and convenience and cost. I'm Nir Patel, and I'm medical practice manager with Direct Med, and I'm also a licensed health insurance agent.
I'm Angel Salcedo. I'm an insurance broker, and I've been selling insurance for 10 years. Employers are hurting right now, and we see that every day. We talk to employers daily, and we see how they can no longer afford these high premiums, and their employees can no longer afford the out-of-pocket cost. So that's where we come in. We help them put together a strategy that gives them the best of both worlds: an affordable health plan with a doctor that cares about them and a better experience than they've had before.
Direct Med is a direct primary care membership subscription-based practice. We started it because we feel that the healthcare system is broken. We've been patients for our entire lives, and we have been shuffled through that confusing healthcare system. And we decided to create our practice because we wanted to shield our patients from the broken healthcare system, make sure they get amazing care, and they never overpay for anything they ever need for their health.
So yeah, it's just like you pay for Netflix or some sort of streaming service. It's an ongoing subscription that really relieves the doctor from the insurance companies that try to dictate how to take care of a patient. So it's bringing family medicine back to what it was 50 years ago.
The strategy that we teach employers to implement within their business is to take their insurance plan and restructure it, go from fully insured to level funded, which typically has a lower cost, and it obligates the carrier to give you transparency on where your money's going. And the other key to success is to couple it with a direct primary care practice. That direct primary care doctor is incentivized to keep your employees healthy and well. Unlike the traditional system, where they want employees to continue to come in so they can bill insurance companies over and over and over again.
The employer wants to provide health care to their employees. The ironic thing that happens when that employee is getting care, the claims that are generated by that are hitting the policy, which in turn increases the premium, much like auto insurance. If you were to file an auto insurance claim every single week, your policy would skyrocket and you could no longer afford it. What we do in our strategy, we allow that employee to get the care that they need, but it doesn't harm or go against the policy, which reduces the cost year after.
Direct primary care is the key to making that happen because we handle 80 to 90% of all of the employees' healthcare needs, and none of that dings the insurance plan, allowing the cost to continue to go down.
Well, again, by getting better care, they're reducing the amount of time that the employee is not going to work. Once you really dive deep and get to know the doctor in functional medicine, you start realizing that they educate the employee on how to take better care of themselves, which if they're healthy, they're working, which increases productivity for them.
If you're an employer in Austin or anywhere across the country, we can help you implement this strategy. We have a full network of thousands of direct primary care doctors that are accepting new patients that we can help link up with employers. And you simply just need to contact us. You can go to our website, www.directmed.care. You can live chat with us there, or you can contact us by phone or text at 512-842-7633.
So, yeah, so like I mentioned, that I think that video explains it pretty well on how direct primary care can couple with just a different approach to the insurance for the employer. So again, I think it's kind of it's new, and so I know it's going to be kind of a scary thing maybe for employers to think about changing some of those. Changing, like he mentioned, from a fully insured to a level funded. But these guys have done it for thousands of small businesses and are, they're saving money. So I would kind of encourage anyone that is going to watch this later to reach out to me if you have questions, or if you want to talk about how you change your insurance plan, or what do we do? How do we start that? I will get you in contact with Nira, because he's going to be the one that helps kind of guide you guys through that. And he is wonderful, and he'll hook you up with somebody here in Virginia who does similar to what he does there in Texas. But he will be kind of the intermediary person that will facilitate those things. So again, I think if anyone has questions, I just encourage you to contact me. You can email me, Shannon.miller@360 I say this wrong every time. Shannon.miller@360health-wellness.com. So you can email, you can call 540-360-1077. And then, I'm happy to talk to you more. And I would love to be able to help my community and help my fellow small businesses take care of their employees.
Yeah, this is great. I definitely, once I get off here, I want to find out if there's any local insurance agents that know about this or perhaps are familiar with this, because it'd be great if we had a partnership locally that people could turn to and just learn more. I'm sure there's going to be a lot more questions, as with anything that's new. What I really like is the flexibility that you have, that there is no long-term commitment. People can try it out and see if they like it, whether you're a small business or just an individual with the plan. I know several sole proprietors or independent folks that have really high deductible insurance plans that may be looking for something that they can have more regular care for, different things. And as we go into the winter months, just health is becoming a #1 priority for so many people, with so many things happening, around us. You want to be able to take care of yourself, So I think this is great. I know we didn't add anybody on here to add additional questions, but I think that we've covered a lot, at least enough for people to, if their interest has been piqued, I encourage you to reach out to Shannon. If you missed some of her contact information, they are a chamber member. You can go to louisachamber.org. Under the community info tab, find a business, and you'll be able to find 360 Health and Wellness for more follow-up conversations and so forth. So appreciate you taking the time to be with us, Shannon. Is there anything else that we maybe need to cover that we haven't?
No, I don't think so. I think that was it. Just kind of getting the basics out there and just letting employers know that there's other options that are available.
Well, this is great. Thank you so much for spending time with us. Thanks, everyone. If you have any other questions, just get in touch with Shannon or myself. I'll be happy to get you connected. Thanks so much for joining our resource Zoom this morning. Have a great day.